Good afternoon, everyone, and welcome to session 2 of this learning community, fostering belonging, supporting integration of newcomer and refugee and migrant youth for behavioral health providers and organizations serving refugees and migrants. Thank you so much for joining us. Let me introduce myself. My name is Luz Chapa. I will be your host for today, and I'm also a clinical consultant for the RMTAC team. So today we'll be diving into session 2 of this learning community, cultivating support networks, essentials for integration. And we hope through this learning community that we can foster a collaborative environment where we can share knowledge, resources, and best practices. And that's the power of these types of learning environments. And it's what it differentiates a learning community from a webinar. So learning communities are active collaboration and engagement. And SAMHSA, which is our funder, really emphasized creating active learning opportunities to help providers in this space to apply what you learn into your day-to-day and ultimately make a significant impact on your professional and personal life, but also as well as the lives of those that we serve. So I really encourage everyone to share your insights, ask questions, and support one another throughout the session. And with that, let me go ahead and introduce myself. And as mentioned, I am a clinical consultant from the RMTAC team, and I am very excited to be here today to kick things off today and set the stage for an exciting and productive session that lies ahead. As you can see, our agenda for today, we have a dynamic session planned ahead. We'll begin with introductions, followed by a brief discussion on learning outcomes. Then our subject matter experts will take the stage for an engaging panel discussion, which will lead into an opportunity for questions and share insights. And while no formal breaks are scheduled during this session, please feel free to step away as needed. And with that, let's go ahead and transition to introducing our SMEs. To meet our expert panelists, we are thrilled to have these incredible experts joining us today. Their insights, experience, and knowledge will spark thought-provoking conversations and provide valuable perspectives. So get ready to learn, engage, and be inspired. We would also like to introduce our facilitators, who you will hear from later in the session. When we all break into smaller groups, there will be an opportunity to engage with these skilled facilitators. So thank you, Dr. Mutsa, Dr. C, and Dr. Teneo for being able to be here and sharing your expertise with our group. And from RMTAC, we have a solid group of producers who make it all happen, and they work behind the scenes to ensure everything is running smoothly and efficiently. Thank you to Diana and Sonia for all that you do for these learning communities. They do an incredible job in putting these events together. And to our participants, if you encounter any technical difficulties throughout the session, please feel free to reach out to any of them via chat. Their names and roles appear on their video screens. So thank you, RMTAC team. So why this topic? And why cultivating support networks? Why is it important for this topic in supporting integration of newcomer and refugee and migrant youth? Well, I want to invite you to think of integration, right? And integration is around us every single day, whether we realize it or not. And an example of this is, let's say, for example, when we go to places like the gym or the yoga studio, or if you're in a cycling club or art workshops, a crafting club or cooking classes. And for my parents out there, think of the many messages that you receive from the clubs or programs where your children are involved. For instance, maybe dance classes, sports programs, or maybe other academic programs or extracurricular activities that they're involved. Integration is present when we engage in our everyday activities. And if we think of the reasons why we have been committed to these groups, these clubs, these programs, it's probably because of the way they make us feel. Like we belong, we feel accepted and supported. And we feel like we are a part of a greater community. So just like that, when we seek places and groups where we feel connected, for refugee and migrant youth, these opportunities are even more. So they need that. The fostering integration is pivotal for ensuring the mental health and well-being of newcomers because it cultivates a vital sense of belonging and connection while simultaneously opening doors to essential resources like education and healthcare. And those are crucial resources for their stability and security. Moreover, integration also helps individuals build that strong positive identity by valuing their background while navigating their new environment and contributing to their overall resilience and ultimately strengthening their mental health and overall well-being. For youth that face significant hurdles when integrated into new communities. However, fostering social connections is crucial for a smoother transition. And these connections, they can build bridges, fostering understanding and inclusion, and also they help to dismantle the barriers between the newcomer youth and the host communities. And lastly, it's not just about being physically present in a new community. It's about becoming an active and engaged member of that society by being able to contribute to it and also being able to benefit from it. The lack of integration and socialization for refugee and migrant youth can have profound and lasting negative consequences on their mental health, social development, education, and overall well-being. And some of these things that can be impacted is like for refugee and migrant youth, if they lack the ability to communicate, that often experience isolation and loneliness. This can stem from difficulties expressing themselves or accessing essential services that they may need or building meaningful relationships. There's also higher rates of mental health conditions for refugee and migrant youth who are exposed to adversity. They're more likely to experience things like depression, anxiety, and PTSD symptoms, and other mental health conditions. And if we look at these a bit deeper, social isolation and loneliness are associated with these conditions. And interventions that promote that social support and connections can help to mitigate these risks. The lack of integration and socialization for youth can also exacerbate the negative effects of trauma on youth by impacting their ability to build supportive relationships. They can hinder their coping mechanisms and potentially increase feelings of isolation, guilt, and shame. When activities that are offered in schools and community settings, they can help to build that resilience and improve coping skills and also reduce those symptoms of trauma-related conditions, for example, like PTSD symptoms. And an unsuccessful integration can have profound negative impact on their overall well-being and development during their adolescent years, which can significantly undermine their mental health and school adjustment. Because as we noted previously, when youth lack the ability to communicate, and now let's say that they're adding discriminatory attitudes or they're dealing with racism, they find it even harder to form those new friendships and connect with others. And this also leads to those feelings of isolation and loneliness. And in general, integration and socialization are interconnected processes that are fundamental to human development because they provide the framework for learning, skill building, and emotional well-being and overall health. Now let's go ahead and move on to just a quick overview what was discussed in the first session. So during the first session of this learning community, we were able to address the challenges of refugee and migrant youth that they face during socialization and behavioral health. Behaviors such as withdrawal, aggression, or non-compliance may be misinterpreted without considering culture factors or trauma history and acculturation stress. The participants who attended the learning community for the first session, they were also able to explore how the influence of culture differences plays in misdiagnosis of behavioral health issues and the importance of applying that culture competency and also applying that trauma-informed approaches when working with refugee and migrant. We also explored the prevalence of mental health disorders among migrants and current trends and the discussion of the importance of training at all levels of staff to recognize signs and symptoms of mental health disorders for early detection and intervention. And of course, when we broke into the small discussions groups, we analyzed how culture might influence the presentation of these symptoms we're trying to detect. We were also able to examine the barriers for the community and received or accepting care, such as culture stigma, lack of trust on the healthcare systems, and lack of medical education, language interpretation, and a lot more barriers that were discussed during session one. And so in today's session, we will collaborate with fellow mental health professionals to share experiences, strategies, and solutions to address the challenges in socialization and integration. We will also recognize behavioral health care trends and effective strategies to support the unique needs of refugee and migrant youth. And as mentioned earlier, this learning community is intended to be engaging and collaborative. So we really highly encourage you to take advantage of the knowledgeable individuals in this session and by being an active participant. Well, with that being said, let's go ahead and move on to our breakout session. And as we move into small breakout rooms, let's keep in mind the unique challenges that refugee and migrant youth face. As we had discussed in session one, it was language proficiency, culture differences, and loneliness and isolation. Let's take this opportunity for us to explore further by sharing insights, experiences, and any other stories that are related to this topic. And just to talk about the breakout session structure, we're where we will be moved into small groups and we'll discuss just a breakout session. A reminder to record your session, identify a speaker to present on behalf of the group so that you're able to briefly share the points that were discussed in your group session. And so welcome everyone back. And so now we're going to move on to our roundtable discussion. And at this time, we will take some time to hear from each group. I'm going to go ahead and start with Dr. Z. If you can choose your spokesperson so that they can share their feedback and experiences of their group.
Yeah, well, yeah, exactly. Thank you. And our wonderful spokesperson is Estefania.
Hi.
Hi, Stefano.
Hi. You could call me Effie. My nickname.
I'm sorry, Effie. Thank you.
Yes. No, I don't know if that's part of culture, but every time I would get in trouble, my mom would call me by my full name. So I kind of like attached it to that. But I both are fine. Yes,
Yeah,
and the
drive that similar.
thank you. The part of the qualities that make authority figure respected and trusted in the culture. Uh, we discussed like the higher level of education, someone in a position of authority, like a CEO, of religious figures, or and uh, and then we also talked something not as tangible, but is kind and compassionate, uh, and to be respected. That authority figure to be kind and compassionate. Then also on how the culture background shapes the way that youth perceive or respond to authority. Uh, we also spoke about religion, and that was important. And then also respecting, well, I mentioned respecting the our elders and being, conservative with, with our elders. And then sharing the experience when a young person, or that we or others worked a challenge an authority figure, what was the context and the outcome. We discussed, or Dr. Z brought up the young person that challenged an authority was admitted admitted to the hospital. And then they also spoke about how the teenagers come here and they work in their home country, and then they come here wanting to do the same, and they're in foster care, they have to follow rules, so that can be challenging for them. And just uh, having that challenge of what their culture expects for them to work and take care of their siblings, and here they, we expect them to be kids. And
Yeah.
that's the report. Thank you.
Thank you, Ms. Effie,
Thank
for
you.
sharing
Thank you.
the wonderful
Thank you.
discussions. And we move on now to Dr. Mutsa, who is your spokesperson for your group.
Yes, thank you. Our spokesperson is Grace.
Hi. We had various different perspectives on what makes an authority figure respected. Some mentioned, having a title, having the letters after your name, whether you're a doctor or, a therapist or whatever. Some we talked about age, just anyone who's older than you is respected, and you follow what they say. They talked about gender and how some cultures follow the authority of a specific gender more than the other. And a specific experience we talked about was the gender dynamic, how sometimes different cultures listen to male rather than female authority. And I didn't have like a this is how it's solved problem, but sometimes you have to change staff around. Sometimes it really depends on the perspective of whoever's working with a kid, where you talk about like this is how it is here in the US, or you accommodate more to how things go. But I think it's difficult because you don't want to completely change how they're used to things. At the same time, the reality is different in the US. So talked about that dynamic as well.
Thank you, Grace, for sharing that insight. And I believe you were in my session for when we did the breakout room, and some of those things that you brought up right now, we discussed it in our breakout session. So it's wonderful to see you again, and that you were able to go deeper into discussion for that. So and now let's go ahead and for Dr. Danielle.
Thank you. Our spokesperson willingly and graciously committed to providing some insight was Genesis.
Yeah, so we also touched up on a couple of things that the other group shared. I think one of the most important things that we touched on was basically that the children, are going to have that difficulty with the transition over from their home country over to us, right? And how that identity that they have from their culture is kind of enmeshed with another culture that they're coming to with us, right? So their sense of like authority is also based on those things mentioned, such as like the gender, the roles of that, and the expectations that they had back in home country versus what that looks like here, right? And how that can be very difficult because they seem like they're forced to have a single identity when it's sometimes a little bit more than that, and having those conversations with them and making those transitions can be difficult for them.
Yes, yes, I can. Thank you, Genesis, for sharing that. And so I believe it's my group next, right? So I chose to spokesperson for my group because it had really great insight on what we were discussing, very different viewpoints, but they were very insightful. So it was Mr. David Herrera.
Not knowing the language and feeling inferior could actually impact the openness and the therapeutic alliance between the therapist and the client, right? So it is very important for that to be taken into account, that a lot of the minors who are barely coming to the US might perceive themselves that is as inferiors or as not part of this country, and that could actually also affect their openness and also their developmental stages, such as if they're from a very young age, their attachment patterns could also be something very important when it comes to making those bonds and understanding the culture, right? Because it has a lot to do when it comes to feeling a part of a culture such as the United States, right? So assimilating your roots and coming into a different one is it could impact the child's openness. That was one of the things that we were talking about in our.
Thank you, David, for sharing that. Is there anything you wanted to add, Victoria?
The other thing that we discussed was just not necessarily language barriers, but the way that some minors adjust faster than others, right? And how maybe certain behaviors are perceived as like behavior issues rather than adjustment issues, or maybe minors experiencing symptoms of anxiety, and how as a team we work together to kind of overcome those stereotypes and educate other minors, right, of the differences between each other and how we have to be respectful of how we're all adjusting, and also making sure that all staff members are also aware that some minors will have a more difficult time adjusting or just being patient, in the shelter, and how we use the correct vocabulary and the correct way to treat them and develop healthy coping mechanisms to help these kids. So that was just another thing that we discussed.
Thank you, Victoria. Thank you for sharing your insight. So I really hope that through these discussions that you were able to spark some new ideas and insights on how to support youth at promoting their well-being and to successfully integrate into society, right? With varying tones and focuses. These were great points that we discussed today, and different viewpoints bring unique experiences, knowledge, and insights. So this leads to a more complete and nuanced understanding of this topic. So thank you everyone for your participation in this discussion. And so now to the moment we've been waiting for, right? We are excited now to hear from our panelists. And as your host, I will mediate the conversation and ask the questions. We'll explore various perspectives on solutions for support systems, response to authority, language and culture, impulse and decision-making for refugee and migrant youth. And to our audience, we really want you to feel like you are part of this conversation. We will post the panel questions to the chat, and we will keep the chat open for you to share your insights, experiences, and any additional questions. And of course, while I am mediating the conversation, I will do my best to highlight all of your amazing comments and questions. But if I skip some or if something happens and I'm not able to do that, at the end of the panel, we will also have a Q&A session and a roundtable discussion. So this will give us some time and opportunity to revisit any questions that maybe they were missed or address additional questions that you may have. So during the roundtable discussion, we look forward to hearing your insights and experiences as well. So with that being said, let's get started. I really like the setup, the way this looks. Okay, so we'll start with Dr. Lizzie. And if you can share a little about your background and your experience in working with youth.
Good afternoon, everybody. My name is Dr. Lizzie Ortiz Mendez, and I'm currently serving as the project director here with RMTAC. I have about 30 years of experience working in social services field. I've done different work in violence prevention. I worked as a clinician. I worked in a local mental health facility. I have had some years as an educator as well. Luckily, through all of my roles that I have had the opportunity to work with refugees and migrants through that. And so I'm excited to answer some questions, and I'll pass it over to Dr. Danielle so she can introduce herself.
Hi, thanks for having me. I'm Danielle Bill, and my work began in 1998, where I was assigned my very first client. He was 1.5 years old, and I did not know that my career would expand to where it is, but he was a different culture than I, and I learned so much. He worked in the inner city, and so where I didn't have specific experience with migrants and refugees, it was adjacent because a lot of people had immigrated from another country or part of the world. And so I started doing direct direct service provision and did almost every job under the clinical kind of space, all the way to owning a non-public agency where I support families in the inner city, really teaching and promoting what safety escalation looks like, what cultural humility looks like, what service provision looks like for sensitive members of our community. And so I'm happy to be here. Thank you so much for allowing me to join.
Thank you. And it's great to have you both here. And let me just share a little bit about my background. So, um, my background is in working with youth of different cultures and backgrounds. I was an at-risk counselor where I work with students who are facing challenges and that could hinder their academic and social emotional development. I also worked at an inpatient and outpatient center for adults and youth, but mostly my cases were with youth, and I had various levels of cases. There were high-level cases. There were also at a residential setting, right? So these were youth who lived at the facility and they were receiving round-the-clock care and supervision, as well as other services. And the other type of cases that I've worked with youth are the intensive therapy unit. So these were youth that were receiving services like individual counseling, group therapy, medication management, and other therapeutic services as well. And aside from that, I was also a clinician at various unaccompanied minor programs, as well as a lead clinician for unaccompanied program, and then program management team for also shelter. And so for me, it's very important that we understanding the complexities of integration and socialization, and also being able to develop effective strategies to support newcomers, refugees, and migrant youth, right? And creating, and you're going to probably hear this over and over again, repetitive, because creating that safe and supportive environment and tailoring those approaches to each client's unique needs, that I believe is crucial for effective therapy and positive outcomes. So with that being said, let's go ahead and jump to question 2. And this one would be for Dr. Danielle. So given the complexities of refugee and migrant youth development, what strategies can providers implement to effectively support youth in their responses to authority, considering the influences of language and their culture?
I will defer to Dr. Lizzie if that's okay. Does that sound good, Dr. Lizzie?
That's fine. So my experience has taught me to be patient with the youth. I work with children who were not used to working with women as authority figures, or authority figures who that they felt that they could trust. In one of my situations, I was helping handle a crisis with the youth. He was from Central America, and I was trying to, help and de-escalate the situation. And the staff are telling me, the child does not. The child does not respect women or doesn't want to hear from a woman, and so I made it clear to the child that, I spoke in a low tone. I have had the opportunity of sitting on the floor with many children. And so I sat with him and I explained to him, look, I'm not here to put rules on you. I'm not here to tell you what you did wrong or anything like that, but this isn't a safe environment. Let's go ahead and move over to my office where you can sit. You don't have to talk to me. You don't have to do anything. And so he accepted. He went into my office. I told him I have a lot of work to do. I'm going to sit on my computer. I'm going to put on some music that we can both listen to, and you can just sit here in silence. So I just think giving the youth that autonomy of, you have control of the situation. You have choices that you can make. I gave him the space and allowed the youth when he was ready to start talking to me. It was something not even related to the original situation. It was having to do with the child not having socks, right? And then I was able to explain to them, how whatever, but I did address the issue that had been brought up about female authority figures. And so I explained to the child that my position at the time, and then I also educated the child. Psychoeducation is very important on the fact that now in the US, you're going to encounter, female police officers, you're going to encounter female managers at restaurants, at stores, in your school, you may have a female principal, things like that. And so I think just taking the time for that psychoeducation, but when you have that initial opportunity to work with a child, not just jumping right in, letting them have the opportunity to, have that confidence in you. When I've encountered situations where there's a language barrier, I've always taken the time to try to seek an interpreter, use an iPad or pictures. I especially had situations where children were talking about the food, and so something that they're describing, you know, um, as simple as a corn product that we call tortilla, somebody else may call it something else. And so just making sure that you take the time to understand what it is that they're saying, and that can help, with helping them feel supported, especially if you are that authority figure to them. Dr. Danielle, something you'd like to add?
Yeah, I love that you framed what trust can look like in action. That's like vital. A couple of other considerations is predictability, right? And being kind of thrusted into this new environment. It can be very scary not knowing what expectations are or how I'm supposed to engage in this space. And so creating a sense of predictability might be really, really valuable. And then also, if I make a mistake, what does restorative justice look like? How do we, and this is a big component to me because we're going to make mistakes, but what does restoration look like? How do we repair fractures, right? And can that happen openly and safely? So, just to add to those thoughts, Dr. Lizzie.
Yes, thank you so much. I also wanted to tap into something that was mentioned regarding adding that, that culture perspective. And when we are working with youth, one of the things that I think is very, very, and right now, right, because we have a lot of our participants who have clinical background, and in speaking with them in the breakout rooms, I think that it's very important that when we provide, right, these assessments or interventions, right, that they are culturally appropriate, right, resources. And I know that sometimes me, working at the shelter when I was a clinician, and even as a lead, as a supervisor, these were some of the things that we struggled because it was hard to finding, the right resources or the right type of assessments that we can use for, this particular population. But and also because they have to be cost effective, and if they're free, it was even better, right? But we also needed to ensure that that they were providing the services that they need to be providing, and that they were being evaluated and properly, right, for the youth. But one of the things that I'm going to say is that resources like RMTAC, where we can provide that added support and assistance, where we can do the research and for organizations and agencies, and to provide the material so that we can continue supporting organizations and providers and help youth. I think that's very, very important. So I just wanted to tap on that because I remember that was a struggle when we were at the shelter as a supervisor and as a clinician.
Thank you, Luz. Just one last thing to add on this question is, I know that when in our discussions we've discussed impulsivity, and then how does trauma play a role? So making sure that we're assessing to determine, is it a protective factor? Is it lack of respect or not wanting to listen to the authority figure? Is it a protective factor, or is there actually a behavioral health concern that needs to be addressed? So making sure that we're doing the proper assessments, checking in with the family, understanding the child's background, getting that psychosocial history. And it's very, very important, so that way you can make strategic moves as what is the best way that I can support this youth. So
Yes.
thank you.
And I also wanted to add, only because I just, for the resources, is if you're working with a youth, right, and not only having the family involved, but if the youth is in the agency or in the facility, bringing in and collaborating with other departments. So maybe, and they mentioned it in the breakout session, having those staffings, right, staffing the cases and having those treatment team meetings where even if the child is not present or may not want to be present, you're still collaborating and you're staffing what's going on, any red flags that you notice or that the child may be experiencing. The teacher, bringing in the teacher, the educator, and see what she sees when the child is there. How is he learning or how is she learning? What's the education level, or is there a language barrier? Is there something else that's going on? The case manager, the shift leaders, the youth care workers are also with the children. They will have also really great insight and feedback for us to be able to make that collaborative effort in helping the child.
Yeah, and sorry, no, there's like, so we can talk about this all day, but in thinking about actionable steps about creating, right, this safe environment and inviting collaboration, I'm thinking of and honoring understanding how predictability can play a role in dismantling someone's fear response, right? Might be to create established routines, not just for the youth, but for the adults or the people in authority, right? So what are the expectations of myself and what are your expectations? I think offering choices to teach power, right? And empowerment. So allowing for some decision making. This might alleviate some sense of loss of control that a youth might experience. I think validating the lived experiences Dr. Lizzie was talking about. Um, being overwhelmed by these new circumstances and not knowing what to do with that. So how do we validate like that it's okay that you feel like this and we're here to support you through those experiences without having to fully disclose a person's traumatic past, and then just being trained in what safety escalation looks like. This is an area that I'm deeply passionate about, is how do we safely de-escalate if a youth is, feeling triggered or having these trauma responses that Dr. Lizzie was talking about. How then do we step in and avoid power struggles to even the playing field and just offer safe space for safe de-escalation?
Yes, definitely. It brought up back a lot of experiences and a lot of the crises that we used to handle at the shelter. And not only that, but supporting staff, right? Because sometimes we want to continue to, protect the integrity of the youth. So making sure that we don't disclose confidential information, but at the same time, making sure that we're also, again, working collaborative and supporting staff, right? So if we have to step in to assist in that crisis or to see, if we can help in any way, I think that's very important. And that's something that based on my experience, that's something that I was always ready to do. I and thankfully, I never had any bad situations. I was always able to calm the youth and be able to de-escalate the situation. And, and they would willingly say, I need external services. I need to be hospitalized, or I'm not feeling well. I can't be here. If I don't receive the assistance, I may do something today that I may regret. So, it was really good feedback that throughout this discussion, panel. But we're going to go ahead and see if we have any questions. I forgot to check those on the chat.
There's some insight from David Herrera in the chat. He says, I also wanted to mention that children in shelters are supervised 24/7 under structured social norms, and their behavior may change throughout the day. Just as adults behave differently in various environments, children also respond differently depending on the system they are in, as their behavior is shaped by the morals and values learned from diverse family types, whether more rigid or liberal.
Yeah.
Yes.
I think to add to that, David, the thought I had when I was reading your comment is that authority isn't just shaped by individual like personalities, that it's really, really deeply embedded by the cultural norms, and conflict may arise when we've been allowed to engage in one culture, right? And then we're coming to a different culture and we're having to shift so abruptly. And so really understanding the deeply embedded kind of messages that we receive as we're learning a culture, either in an old familiar environment or into a new unstructured one. So thank you for sharing that.
Yes, thank you. Okay, so on to the next question, and this one goes to
Dr. Danielle.
Dr. Lizzie.
Dr. Danielle.
Dr. Danielle.
Yeah.
Okay, so what role do parental relationships play in the process of integration and acculturation of youth?
Yeah. So I think parents are a youth's first contact of socialization, right? That's the reality, is that's usually where they first learn what socialization looks like. And parents are often the original teachers of their own culture. So the messages that a youth or that are being sent about belonging, identity, and how to deal effectively or ineffectively with conflict shape how then a youth navigates new environmental contexts, right? And oftentimes it might be very appropriate to engage in one behavior within the safe structure of a home, and then they go out into the community and they don't necessarily know how to integrate that information or how to transfer that information. And so I want to kind of frame this idea about socialization and the messages that are received regarding how to deal with conflict into three kind of areas. Parents usually provide information about socialization. The first area is what we call like promotion of mistrust, right? So a parent might teach their child or warn them about avoiding or how to avoid interactions with non or out group members, right? So this is how we deal with this in our culture. Someone may not understand that this is how we're dealing with these. So if you see anyone outside of our culture, do not engage, disengage, walk away, right? Where they're really setting up a situation where a child may feel warned. So that's one area. Another area is how to prepare for bias, right? So teaching their children to anticipate what discrimination looks like and what discrimination feels like so that they can acknowledge it and recognize it. They also might provide ways to help them identify how to stay safe, right? And how to kind of be consciously aware of your surroundings so that you can be safe in those environments. And then the third type of socialization is what we call cultural bridging. And this is really where parents are encouraging their children how to succeed in dominant cultures while also maintaining their cultural identity or their heritage, right? So really this true assimilation of these cultures. And some of the things I want to kind of just mention as barriers around this socialization is that this guidance can be protective, but it can also limit full integration, right? There's, kind of barriers that come up. So youth, again, might feel conflicted, especially when a message from an adult figure doesn't align with their own lived experiences, right? And an example of this might be like in the Black or African American community, young little Black boys and girls are taught to fear police, right? Because historical context has dictated that police are unsafe to this population. And so this message may then translate to a child not knowing that a police officer can signal safety, right? And so just being aware of that. So as providers, we can engage both generations or both cultures to realign what expectations look like. We can reduce some intergenerational stress, and we can cultivate bicultural competence, right? So integrating information from both sides, where these generations or cultures can really feel like they're providing useful insights and active, helpful, healthy way of moving forward.
Perfect, Dr. Danielle. Yeah, those are the some of the same points that I had. One of the things that when I was reviewing the question is it comes back down to respect. What did the parents, instill in the children about the level of respect, respecting others, being open to new opportunities. I have had worked with, children and, they're not having the greatest day, whether it was in the classroom, in a program or, during a session or something. And it's like, what did your parents tell you today before or the last time you saw them? Pórtate bien, behave. What does that mean? What does that mean? Does that mean the way you're running around here, or the way you're talking back to me, or the way you're, and then it's just reflecting on them. But then you have the other side. I have had sessions where, or working with families where education wasn't, the most important thing, study habits, TV time was more important, the novelas are more important than anything else. And so it's like, that is where it's going to take just a little bit more work, that psychoeducation, and making sure that you instill in them that how do you want to pave the future? What do you want to do? Like, how do you want to help your child? Okay, so you didn't have this, and this. How are you going to help instill that in your child? So getting that parent to help with that integration process, even if it wasn't the easiest thing for them. And like I said, it goes back to respect, teaching somebody how to do effective conflict resolution, and being open to learning and growing. I know there was a question in the RSVP of how do you get parents to buy into behavioral health care with the stigma of it? That is an experience that I have had numerous times, especially when it comes into having a child take psychotropic medications. Es que no está loco, or they're not crazy. Yeah, but they have a mental health disorder. They have a health disorder. Just concentrating on that part. I've taught the difference. If I came to you telling you that your child's blood sugar level was at 200, would you be okay with me putting him on diabetic medication? Yeah, you would be okay with it. But it's not just the medication. It's going to end up being diet, exercise, all these other things that go into play. Okay, I'm telling you that your child has depression. It's the same thing. They need medication. Should they take the medication forever? I don't know, but we can start with the medication, but we also need to instill diet, exercise, all of those other things. So, helping that parent understand that it's a diagnosis that needs that intensive treatment. That was a very good question. So, Luz, I don't know if you'd like to add.
Yes, actually, you hit it right, right on the money. I was just thinking of that because I've had really good experiences working with parents when they're involved, but I've also had some, not so good experiences. But um, parents and caregivers, like they're the primary figure for transmitting, that culture heritage, the values, the respect, the norms to their children. And I've worked with several cases where there's a very supportive parent-child relationship and there's that effective communication. And so that facilitates that positive integration and that adaptation because in the parent or the caregiver, they can provide that emotional support, that guidance, that flexibility, and not only to the child, but also to the organization, right? So it's kind of like a team effort and, like I mentioned, a collaborative approach. And so this really helps to navigate the challenges because parents and caregivers, they're involved in that process. So they're helping their children to navigate these complexities, culture conflicts. And, if there's issues, like we talked about the psychotropic medication or when they need to be referred for external services for further evaluation, that can always be something that's very sensitive to parents, especially if they've never, talked to a counselor, a mental health professional. But one way that I've done it and that it's worked, it's having that open and transparent communication with the parent, right? Or the caregiver, whether it be the abuelita or the tia that's taking care of them, demonstrating that empathy and the importance of highlighting, like you mentioned, Dr. Lizzie, the positive impact of therapy and its effectiveness, right? So when we're having that open communication, one way that I've used to explain it is like using crutches, right? So if you have a broken leg and if you break your leg, you will need crutches, right, to help you move or to walk from one place to another. And not only that, but to heal properly. And so therapy, I've explained, can be used as a crutch, right, or as a temporary support system to help navigate those difficult emotions or whatever they're feeling and to hopefully recover, right? So
Yeah.
that's one way that I've used this to illustrate that therapy is used as a tool to address their needs and the importance of, mental health is just as important as physical health. So that's one way that I've done it in my experience, and it's worked wonders. But also, like I said, providing that support for the staff, right? Because sometimes it's a little bit difficult explaining that to parents, especially to parents.
Yeah, I want to add one thing to this discussion, or 2 points to this discussion, is reframing, right? What behavioral health looks like. And for me, that reframing looks like this is a act of resilience, right? This is an act of proactively taking charge of what's happening. So not just a label or something that's happened reactively because of this youth's behaviors or what is perceived as behaviors. And then really where this was embedded was early in my career. A child received a diagnosis, right? And the stigma and this label. But parents were really struggling with the diagnosis and how to support this child. And then that family couldn't go to work, right? And then work was impacted, and that business was impacted in the community, right? And so if we're looking at an ecological systems, we understand that it's not just about this diagnosis, that it's all of these contextual factors, and that this one child isn't the only one who needs the services, right? Because then we create opportunities to other, right? That's their issue, right? So then how do we model what this looks like? So then we're providing resources for families. Well, how are you coping with the diagnosis, right? And how are you taking care of yourself so that you can go to work and earn money for your family, right? And take vacations and do all these beautiful things that life also has to offer, right? So modeling what healthy integration of accepting some of these resources looks like, so that it's not just this one person, but that it really is a collateral effect of framing, like, this is what I'm doing to be resilient and kind of work through these circumstances.
Thank you, Dr. Danielle. We had quite a few questions to go over, but we can talk forever, right? So we're just going to go over a couple of more points because our time is dwindling down. If questions came up for you all during this, if you would love to tap into us and get some more insight as to some strategies that you can use, please don't ever hesitate to reach out and send us an email. All of these are some of the things that we can help you with. But just really quickly, strategy so that you can engage educators. As an educator, taking a part, like Dr. Danielle says, the family needs that support. And so I know that some of you mentioned earlier, getting that buy-in, understanding the gender, learn about the culture, as an educator, learn about the culture that you're working with. What are the dynamics? How should I address it? Making your classroom feel more inclusive, making sure that you give the child an opportunity to be in a small group with people who speak his native language. Somebody brought it up earlier. I can't remember the name right now. Estefana, about the name. I had put that as one of my examples. I had a child whose name was spelled Jessica with a Y. But when she asked me, she goes, "Can you please call me Jessica?" It was the simplest thing, but to her that was important. And so making sure that we respect that, of the child, that autonomy of what is their preferred way to say their name, and understanding that lack of a language is not mean lack of education. They can be smart, they can, know things about, so give them opportunities, to express all of that. I'll let Dr. Danielle talk a little bit about providers can teach social communication skills briefly.
Thank you. So I think it's important to understand that care providers can teach both nonverbal and verbal social communication skills by using visual supports. I shared this story briefly. My daughter was in kindergarten, and a little boy had moved from China. He had had no prior experience to the American culture, and immediately within 2 weeks of being placed in this American classroom, he was labeled a behavior needs, and he was getting all sorts of psychological and behavioral assessments, and it was simply a matter of a difference in cultures. And so when I came in as a parent volunteer, I just started drawing pictures for for him. He didn't understand the letters TREE because they were American letters, but he understood a picture of a tree, and then was able to correlate that with wanting to go out and sit under a tree, because in China, in school, they're allowed to sit under the tree and learn, right? So simple use of visuals can help. Also modeling what behaviors look like. When words fail us, visual representation of expectations can be beneficial. Also, encouraging peer mentorship roles is really, really vital. So my daughter is an advocate and a little social justice warrior. And so she's the one who's always seeing the student who is othered in these environments. And so she's standing up and she's saying, hey, I'll be the one to show them where the bathroom is, and I'll be the one to show them how to get their lunch. And this can be a very beneficial learning opportunity, right? If we're talking about people in authority and these kind of power and position gaps, when we have a peer mentor, it eliminates any of any of those peer responses. I think also addressing psychological barriers, understanding anxiety, shame, especially in Eastern cultures, what low self-worth can look like, recognizing that these often stem from trauma and marginalization, not behavioral context. And so how do we normalize struggles around these adjustments? And how are we teaching effective coping strategies like mindfulness and emotional literacy? Can we teach autonomy? Is it okay if a child says, I'm feeling overwhelmed in this environment and I want to scream? I can learn not to scream, but then I need you to allow me the opportunity to go sit out under a tree and learn, right? So like understanding some of how those can be utilized. And then also reinforcing strength-based narratives such as I feel, I am, and I can promote empowerment. And then finally, like we've all kind of touched on, is understanding how we can foster identity development, foster self-compassion, and really build up self-esteem. So this can include what digital safety looks like, right? America is really big on social media, and so what does safety look like under these contexts? Understanding boundaries and consent. I am big on consent, and for those who can't consent, what assent looks like. So in every physical interaction I have, I'm constantly saying, am I allowed to touch your body? If I'm working with a child, I get down to their level and I ask for assent. Am I allowed to touch your body? Can I give you a hug? If a child approaches me, I'm constantly saying, hey, I need you to ask me permission before you touch my body, right? This is kind of establishing expectations and teaching the boundaries around consent and assent. Using narrative approaches such as journaling, storytelling, native storytelling, cultural storytelling is vital for fostering identity development and allowing youth to reclaim their own stories, not being told what their stories look like through the lens of someone else. And then really, most importantly, I think affirming any and all intersecting identities. I know it can be confusing for some of us in the older generations, but really understanding how to affirm all intersecting identities can really help in this process.
Thank you.
Thank you, Dr. Daniela. Yes, thank you.
And just one last thing that we wanted to point is that remember there's other support systems out there that can support the youth, getting them involved with whether it's something they're in their faith-based sports programs, reaching out to extended family groups, nonprofits, youth centers, after school programs, community resources, things that are there to help youth. Something that the United States does have is, they're really big on youth development. So making sure that we take a holistic approach in helping, the child. Thank you so much, everyone, for your time and attention. I'll pass it back to Luz.
Thank you. Thank you. This is a great panel discussion. Unfortunately, we are running out of time, so I'm going to go ahead and try and wrap this up. But I know that there were several questions on the chat, and I'm going to go ahead and do this the old way, where our provider series, we would put the email. So if for those of you who shared a question or have a question on the chat, you can just provide us your email address so that we can get back to you, and we will gladly respond to those questions. We apologize, we ran out of time, but thank you to our panelists and thank you for their insightful and knowledge and expertise engagement today. We are going just to move on the summary and takeaways. So there was a lot of key takeaways that we were able to do and achieve throughout the session. And we discussed on ways on how to help youth to effectively interact with authority figures while taking into account various factors, as well as being able to talk about effective methods that do exist to support youth integration into their social environments. And this was a collaborative effort. We were able to work together effectively by creating a setting and an environment where we encouraged and supported that collaboration. So those were some of the takeaways for today's session. And as always, before we close out this learning community, we will share the survey link to complete. Please take a moment and scan the QR code or use the link that will be posted on the chat to complete your survey. Through your feedback and your insights, we are able to see if we are meeting the needs and serving you the best way that we can. And as mentioned in the beginning, no worries. We will be able to send you through email PowerPoints and the information post-event. And thank you for sharing your thoughts. I also want to just quick reminders. We have an upcoming learning community that is scheduled for July 30th and August 13th. So please stay tuned for registration information that will be sent also via email. So again, you can please fill out the survey and provide your feedback. It would be greatly appreciated. And you will see the survey link. So please take a few minutes to scan the QR code or use the link dropped in the chat to complete your survey and provide feedback on this learning community.
Thank you all so much for attending. Thank you, Liz, for hosting and for everyone's work to make this a great event.